Hello everyone, this video is about FAICO examination, cataract. It is truly an honor to have been awarded the gold medal in the FAICO examination for the year 2025 and 26. FAICO has been a wonderful learning experience for me, and I believe it is a great platform to strengthen both your knowledge and clinical understanding. After my results, I have received a lot of questions and doubts from my colleagues and candidates appearing this year. So I thought, why not share my experience and whatever I have learned along the way, so that this video will be little helpful about the preparation, examination pattern, resources, and how to approach the exam. FAICO is conducted in two stages. Stage 1 is the theory exam, where we'll be having the online MCQs, and stage 2 will be the OSCE and the Viva. In the stage 1, you will be having 100 questions, multiple choice questions, and the good thing is there will not be any negative marking, so you can attempt as many questions as you are able to do. In fact, you should be attempting all the questions. The passing mark is 70%. Once you clear your stage 1, that is your theory exam, you will receive a mail that you have cleared your stage 1 and now you will be moving towards your practical examination. So when you are going for the stage 2, it will consist of basically two parts, the OSCE and the Viva. So OSCE can be conducted in 20 stations where you will be having 20 topics, or it can be 4 short cases as well. After that, there will be Viva. Usually 4 examiners will be taking 4 stations of Viva. So now where to start with? Syllabus is very beautifully mentioned in the revised curriculum, readily available online in the AIOC website. And here you can see all the subspecialty are having a separate section. I'll be talking only about the cataract part. Here it can be divided into cognitive and technical skills, and sections are graded accordingly: basic, standard, advanced, and very advanced. So you can take a screenshot of this part so that you can just go for your last minute revision if you have touched the topics or not. So this is the basic part. In the basic part, the most important things are lens anatomy and physiology, which are basic and important. You should be very aware of the numerical values. You should be knowing about the cataract types, morphologies. Very, very important is the systemic associations and different types of congenital cataract, very, very high yield, drug-induced cataract, how to examine the cataract. And another important topic is infection control, endophthalmitis, sterilization. So this part are like more high yield. Next, coming to the standard part, it comprises of phaco-dynamics, the different types of cataract surgery, evolution of the cataract surgery. You should be very aware of the parameters, how it is adjusted in different scenarios. Anesthesia, very important. We feel like we are doing it every day, but sometimes when they ask how much of hyaluronidase you are going to mix, you might get confused. So it is very important you brush up all the values that you are seeing. OVD is very important. The techniques of the OVDs, the different composition percentages also needs to be known. Small pupil management, posterior polar cataract, these are very important topics. And the complications of cataract. Advanced and very advanced, I think we should be studying all this topic in details, not just for the exam, but also for practical purposes and for your practice as well. So we need to know about complex cataract management, pediatric cataract, different types of like complications, ZD, PCR, vitreous loss, if there is IOLs subluxation, how you're going to fix it, secondary IOLs, premium IOLs, all those things you have to know. You should be also knowing about the combined surgeries a little bit. Astigmatism is another important topic. So if you're putting a suture, where it is getting flattened, where to place the LRI, these are also very important topics. Coming to technical skills, this is also divided into 4 parts. The basic, it includes the instruments and the machines, and you should be knowing about the principles, working principle of the instruments. Standard, it includes anesthesia, the surgical part. The technical skills is more about how much you have practically done the thing, how much you are practically aware of the things. The topics have already been mentioned, but where to start? So this is our backbone for preparation. The American Academy of Ophthalmology Lens and Cataract module. You have to read this book end to end multiple times, solve the MCQs mentioned, and this will serve as the backbone. We used to refer to the 2025-26 module. I think the 2026-27 is also available now. Apart from that, these are some additional references. The pediatric and refractive surgery modules are also important for certain topics. Cataract and lens surgery, they have 3 volumes. This also have some topics very well written. AIOS Ready Reckoner was a very, very useful book, and you can definitely refer to it for certain topics. Hansky is always there, and there is another book, Secondary Intraocular Lens Implantation. So all of this have been very useful while preparing for the exam. But once you have read the topic, the most important thing is you should be solving MCQs, and the MCQs you will be solving should definitely include this, and you should be doing it multiple times, revise, do it with your friends, conduct some mock tests, and it will be fun so that you will have an idea how much you are scoring. Is it coming around 70% and above or not? Apart from this, you can also follow videos from iFocus where the topics are very well explained. Once you have cleared the theory, then we'll move towards the practical examination. These are the topics that were asked during my Viva, femtosecond laser-assisted cataract surgery, and iridia, uveitic cataract. And iridia was asked in details, like very minute things were also asked. So it is very important to know topics like that as well. It is very well written in the AIOC Ready Reckoner. So you should be knowing about post-RD, post-RK cataract surgery, EDOF lenses. They will have those lens boxes and certain instruments as well, and they will be asking you. So EDOF lenses, the mechanism, principle of different lenses, how they are functioning, how each lens is different from another IOL. So you should be knowing all of them. CTR, it is not just types of CTR, when to use the CTR. It is not just that. They will also ask you what are the anatomical parameters that based on which you are going to place the CTR, which size you will prefer for which eye, and what is even the dimension of the CTR outside and inside the eye. So all those things needs to be focused upon. Pharmacodynamics, basically, what are your settings? What changes you are making for different scenarios? If there is a complication, how you are dealing, how you are changing the settings, all of this will be asked. These are the topics which are asked in OSCE. The topics that I could recall as well as my friends and colleagues could recall, I have placed it here. Pharmacodynamics, you need to know through and through. Biometry, definitely all the biometers, each biometer working principle, what is different in each biometer. So like what are the evolving things, everything has to be known. OVD is very, very important, again, from practical point of view. Instruments, sometimes they will give you the photo. You need to know about the instruments very well. Intraocular lenses, they will give premium lenses. I think we had a DOF lens, and then there will be sub questions. Pharmacology is a part which we tend to skip knowingly or unknowingly, but the drugs that we are using daily, from proparacaine to antibiotics to steroids, it should be known very well. Coming to complex cataract scenarios, I think everyone is very well aware of those things. But from the practical OSCE point of view also, you might be shown some pictures and you will be asked about the management. Coming to investigations, again, very high yield topic. You should be knowing about A scan, B scan. You can be given printouts of different investigation. So you should be knowing about the all the investigations and their printouts. Coming to the refractive part, pentacam or opscan, I personally did not face any questions, but there can be questions on aberrations, different types of aberrations. So it is preferable to have a basic knowledge of the corneal topography as well. Coming to special signs and clinical images, I remember we were shown a video which had pupillary snap sign, and then there were certain questions. One thing that was given was a photograph of the Miyake apple view. When we go through Kansky, we'll see different images, but rarely we see the view, the name of the view. So Miyake apple view was asked like, what is the name of the view? When you are going through the book, you should also be paying attention to the type of view that is given. bed grading, lens touch, Indian flag sign. These are certain questions that were given. So if we have to sum up all the things, first you should be knowing about your FAICO machine, your settings, your way of adjusting the parameters in different clinical scenarios. That is the first thing you should be very, very well aware. Second, you should be knowing all the instruments on the table. Anything that is shown to you, you should be knowing the instrument and the related things. So every day you are going to OT, maybe you should be keeping your eyes open and you should be seeing each and everything, maybe the cartridges, even the suction rings, all those things you should be seeing. Thirdly, the drugs that we are using, each and every drug, the concentration, indications, contraindications, you should be very well aware. Fourthly, biometry. You should be very thorough with the biometry printouts. And fifth, IOL calculation formula. Each generation of IOL formula, including the newer generation of the IOL formula. Sixth would be IOL selection in certain patients. So this is a very tricky area because you'll be asked questions like there is a 80 years old male who is diabetic. Are you going for a EDOF lens? Or you'll be asked questions like there is a golf player with what would be your preferred type of lens. So you should always be ready with an answer and an explanation for that answer as well. Seventh would be all the complex cataract scenarios, pseudo exfoliation, small pupil, PCR, zonular weakness, all the devices that you would be needing. So you should be very well aware of that. Eighth would be the viscoelastics. Again, very, very, very important. Ninth would be like the secondary IOLs, SFIOL, or iris claw, all those lenses also you should be knowing about it. 10th would be all the complications and their management. So I hope after listening to the video, you have a fair idea about how the exam is going to be. And thank you. I hope you have found it helpful. And if there is any query, you can drop a comment and I'll try to get back to you. Thank you so much and best wishes for your exam.